We're just about 3 minutes past the hour, so we're going to get started here. And we appreciate you joining us for this webinar on psychotherapeutic touch, hosted by Fluence. I really want to give everyone here a warm welcome. I see some familiar names and some new names, some people that I know have been in classes with us over the years for a long time, and some people that are probably new and might be in your very first program with us. So I'm going to introduce myself and a little bit about this program, and then I'm going to introduce our guest today, Sabrina Santa Clara. And just to start off, in order to welcome everyone, this is a Fluence program on psychotherapeutic touch, and we have a wonderful guest speaker today for you, and I think this will be a really interesting conversation if you're interested in psychedelic therapy or just the use of psychotherapeutic touch in general in your psychotherapy practice. But I want to start by welcoming everyone and inviting you, if you'd like, to share in the chat your name and where you're from. It's really nice to see. Sometimes we have folks from all over the world, all over the globe joining us. And there may be some folks who are going to see this recording afterward. And so just keep in mind that as we're welcoming everyone and welcoming those who are here live, we also welcome anybody who's going to be picking this up and watching it later because the time wasn't convenient for them or they couldn't make it today, but they've signed up or they're going to pick up the actual video access a little bit later. We will be making this available on our website. So in terms of introduction, my name is Elizabeth Nielsen. I am a psychologist and I'm a co-founder of Fluence. And my role at Fluence really is one of oversight and program direction, project design. So I do a lot of very creative stuff in terms of figuring out what the direction of the program and the educational programs are going to be. A little bit of history. Ingmar Gorman, who's another psychologist with psychedelic clinical research experience, and I founded Fluence together in 2019 in order to help address the need for education for psychotherapists and clinicians in the field of psychedelic therapy. And that includes both harm reduction and integration work, as well as things like being able to provide these services as part of research studies. So we run a whole wide variety of projects. We have certificate programs and webinars and programs that are continuing education programs that are accessible to clinicians. We have a program that is a licensure qualifying program in Oregon for people that want to become psilocybin facilitators there. And we run a lot of projects where we're working directly with clinical research trials and drug developers to provide the highest standard of education and training for clinicians that are doing this work in that clinical trials environment. So I know we've got people here who've interacted with us in all those different realms, and it's really exciting. It's really exciting to bring this particular program together because I think this topic is relevant to all of those different domains, all of those different places in which psychedelic therapy may be practiced. So without a whole lot of delay, I want to get to introducing our guest today, who is Sabrina Santa Clara. And I'm really honored to welcome Sabrina because she came to us as initially as a trainee in an early version of one of our programs. And so we're just delighted that we've been able to build a relationship and that she's now become someone who's part of our teaching staff, part of our training staff. And she's had the distinction of offering some live in-person programming with us, as well as several webinars over the years. And Sabrina Santa Clara is located in the Denver and Boulder area of Colorado. She's a licensed psychotherapist. She's a licensed counselor, and she works internationally as an educator, trauma-informed transpersonal coach, and she has extensive experience with non-ordinary states of consciousness and various embodied practices, authentic movement, breath work, somatic meditations, sound healing, and chanting, and things like that. She's trained in internal family systems, or IFS, which I know is an approach that many of you may be interested in. And she's been professionally working with psychedelic experiences that her clients have been having since 2018. And she received her certificate in psychedelic integration therapy through Fluence in 2021. So we're really excited to have Sabrina here as part of this program. And I'm going to welcome Sabrina to the screen now and invite you to just come on and say hello to everyone. And if there's other things you'd like to add about your background and by way of introduction to our audience here, welcome to do that. So everyone, please give a warm welcome to Sabrina Santa Clara.
Welcome, y'all. It's so great. It's so great to see the numbers, even if we can't see the faces. I'm so glad so many of you are here. Yeah, that is pretty much my background. I have a different kind of doorway into this work in that my history has all been in what I often call the weird stuff, right? And so somatic meditation and Japanese Buto and movement therapies and breath work and shamanic ritual and things like that. So I came into this work through that lens. And in fact was doing, I was trained as an IFS facilitator well before I actually became a psychotherapist. And at some point, I was integrating IFS with body work, and at some point I was like, I'm delving into the world of psychology. I should probably get trained. So that's how I went the licensure route, because at some point it felt like an ethical transition for me. So privately, in my private practice, I work now as a spiritual doula. So I do not work as a psychotherapist anymore. I reserve that for my sort of training and education. And in part because it just is more suitable to who I am in the world. I had this thing around patriarchy and pathology, et cetera. So my orientation is more about helping people develop spiritually, right? Okay. While also recognizing and integrating psychotherapeutic work. So not throwing the baby out with the bathwater.
That sounds really great. Can you tell us a little bit more about how you got interested in getting training, especially to work with psychedelics and psychedelic harm reduction integration, and what that pathway looked like for you?
Yeah, so I was living in Las Vegas at the time. And so this was, I don't know, 2017, 2018. And, here in Boulder, there's a lot of holistic psychotherapists. So I'm a dime a dozen here. But in Las Vegas, there really weren't any spiritual counsels. So I was sort of a big fish in a small pond there. And there was a member of our community that was offering people psychedelic sessions and taking people on journeys, primarily with ayahuasca and San Pedro and sometimes mushrooms. And because he wasn't trained, he wasn't a therapist, he wasn't doing really any screening, people were having some challenging experiences, right? So people were having ontological crisis, and people were having memories that surfaced that were really challenging. And so I was the person that people started referring to, even though at that time I hadn't had a lot of psychedelic experiences personally, right? But I knew a lot about the weird spaces, right? I knew a lot about altered states of consciousness. So my practice has been a lot in shamanic journeying and authentic movement and Buto, and internal families itself is an altered state of consciousness kind of practice. And so the idea of working with entities or spirits or the divine were all familiar territory for me. And so I began psychedelic integration before I even knew what psychedelic integration was, right? Before I had a language for it, right? Because that was the need. There was nobody else in my community that was offering, and I started reading as much as I could. And then, there started to be trainings. Fluence was one of the first forerunners of trainings for psychedelic harm reduction and integration. And I thought, I'm doing this, I should probably get trained. And the reason why I chose fluent, so a lot of people I think have more challenges with sort of the creative arts, mystical spaces coming into the psychedelic world. Whereas for me, that was my familiar territory. And so I really wanted a training program that was really rooted in research and that I could really feel like that was going to shore me up and really feel like I had a really good support in knowing logistics, right? I knew the soft stuff. I wanted the logistics, and Fluent stood out in that regard.
Right. Thank you. Well, it's good to hear, what that choice was for you and why you made it. And I recall, obviously meeting you during that process, and just so many of the trainees, I think you're sort of a prime example of this, but so many of the people that come through our program have an incredibly rich history and professional background to begin with. And so we've always been thinking, well, how are we going to help give skills and knowledge that are going to blend with and add to that, as opposed to trying to, rewrite it or start completely from scratch. So I think it's a really solid example of how that can work, for someone who is really well established in a career, and also looking for new additional information and skills and practical methods of working with this in this way.
And to be fair, I also want to name that I'm not saying that Fluence doesn't offer, they offer a lot of creative arts and integration practices, but the underpinning on that sort of rigorous scientific background, that was a deciding factor for me.
Yeah. Yeah. Thanks.
Mhm.
Really interesting. So, I know we're talking about psychotherapeutic touch as sort of the topic of our topic area of our work today. Could you just, for the audience that may not be familiar with that term, dig into that a little and tell us what it is and why it's important, what it is that you're even referring to when you're talking about psychotherapeutic touch?
Yeah, so I chose that term because in the world of psychotherapy, there isn't a common language, right? So if you look at research, first of all, there's not a whole lot of research on touch. It's beginning to get a little bit more, but not in the therapy field, right? Often it's in the massage field or the nursing field. And so there was a lot of different touch language that was being used: attuned touch, therapeutic touch, touch and therapy. And I wanted to start designating, let's actually create a common language that we know what this means, right? That there is a set of indications and contraindications, there's a set of standards, et cetera. So that's why I began to use that word. And that oftentimes people in therapy will start using the word therapeutic touch, which is actually a separate thing. So therapeutic touch is an energy modality that is often used by nurses. It is not copyrighted in the States. It is copyrighted in the UK. And so I really wanted to make clear that we had a clear designation between what are we actually talking about. And the reason I got into that, so my history was with a lot of body wounding because, it's the States. And so I had a long history of bulimia and a long history of bodybuilding and all the muck that came with that. And then slowly moved my way into sort of in my healing process, massage therapy. I was a massage therapist for many years, teaching yoga and meditation and all those things. And as I mentioned before, integrating IFS with body work. And then at some point when I decided to go to school, I chose to go to Naropa. Right? So Naropa is a Buddhist-based institution. They graduate the most psychotherapists here in Colorado, and they have interesting masters. Like they do transpersonal therapy and art therapy and body psychotherapy, right? And so I chose the dance therapy, body psychotherapy track. And as I was in this 3-year long training, they talked very, very little about touch, like shockingly little for a program that was a somatic program, and gave the rhetoric that most of us got, those of us who are licensed clinicians, the rhetoric that most of us got that, touch is a slippery slope to sexual abuse. And I found that really disconcerting, especially for me, knowing how much touch has been a critical component in my own healing. So I began to start doing some research. I began to start, kind of looking at what is everybody saying about touch and what's actually true, and realizing that we've all been spoon fed a basic lie, right? There isn't critical thinking around it, that a lot of the training that we got around touch is really rooted in sort of our fear of litigation and our low touch culture. And so I wanted to provide training that gave people accurate information, whether you ever choose to touch a client or not, right? So that's how I got into this. And the first training that I did, I was working with a nonprofit organization. This is right after I graduated. I was working with a nonprofit organization that had a no touch policy. And so I wrote a paper and explained why no, and basically made my case of why you should be allowing touch within the therapeutic process. And the thing that sold them on that and why we were able to do the roll out the training at that organization was my basic principle is that by and large, clinical research shows that therapist clinicians do touch clients, whether it is a hug, whether it's a handshake, that there is contact often involved. And that because nobody is trained, right? Because we have now made it secret by saying we have a no touch policy, right? That anytime that we have secrecy in the therapeutic container, that's unethical. And that my argument was that because we have made it secret, it actually has a greater chance to increase litigation, because nobody knows how to talk about it. Nobody knows how to document a touch intervention, right? Mm-hmm. And so that's where the initiation of the training began. And then I started offering it to other clinicians, et cetera. And so from the terms of psychotherapeutic touch, right, what I can say is that psychotherapeutic touch is a modality that has a very specific set of indications and contraindications and ethical standards and documentation standards.
Mm-hmm. Right. And this makes a lot of sense in the paradigm of harm reduction too, right? Because when you exclude something from the conversation or you make it prohibited, you're sort of just driving it into a place where it can't be acknowledged, it can't be documented, it can't be talked about, and you risk really increasing the potential for harm there.
Right. Well, even, when you think about people have a tendency to think that, oh, I don't need this training unless I'm going to be touching my clients. But the reality is that, if you have, let's say that you have a client that comes in and they are, an American untouchable, right? That for some reason that they are not deemed as touchable in this culture, or that's their primary wounding, and they go to hug you to go by and you freak out. Now you've just created a deeper wound, right? So none of us know how to actually have conversations about touch comfortably. Right. So even if that's all you get out of it is learning how to have conversation, that's significant.
And then, so this I think leads to, sort of why you're teaching about it. And obviously, we've posted just now some links in the chat to your website and to training that's coming up with Fluence. I'm curious if you could tell us a little bit more, like, what has it been like to bring this to clinicians? What has the experience been like? What are some of the eye-opening questions you may have had, or barriers that you may have experienced there?
I think that the training is overall really well received, because most of us, we don't even know what we don't know, because this isn't even a topic that very much gets talked about, that oftentimes people are completely unaware of some basic things. Like, for example, a lot of people think that our governing boards prohibit touch, and there are no major governing boards that prohibit touch. The social work, what's a social work organization, the large governing body? United States Association of Social Workers.
NASW.
So NASW, they prohibit a specific kind of touch, but no other governing boards prohibit it. And so a lot of people are under the impression that that's the case, and it's not actually not the case. Mm-hmm. Right. And so I think that a lot of times people come in going, I didn't even know what I didn't know. Right. Or that some of the arguments, like I often go over the arguments against touch and basically refute them. Okay. Because if clinicians are touching clients, I want them to actually be able to do that with solidity and confidence and know why they're doing what they're doing, right? And if we get in a conversation with somebody who is appalled that we're using touch with clients, I want them to be able to stand into their seat and be able to say, no, this is why, right? So for example, the slippery slope argument. So the slippery slope argument, if you go online and look up slippery slope argument, right, in the field of logics, and right, it is a fallacious argument. So saying that touch is a slippery slope to sexual abuse is almost like saying that water is a slippery slope into alcoholism, right? That water and touch are just as important as we need for our social and emotional and physical development, right? And so it's not a valid argument. Or, one of the arguments is that touch impedes intended transference. That's a theoretical orientation. Not every therapeutic model values transference. So IFS, we acknowledge that transference happens, but we are not trying to necessarily encourage it, right? Or even in psychedelic therapy, right? That, one of our phrases is transparency over transference, right? And so transference happens, we know it's there, but that's not the point of the therapeutic model, right? And so I want people to walk away, and I think people do walk away. I want people to walk away going, I know what I know, right? That if I'm in an argument and I'm using touch, that I can stand solidity in my theoretical orientation. I can stand with pride, right? And solidity. Mm-hmm.
I think this also speaks to the question or the distinction between what's within one's scope of practice and what is an actual professional competency. And we talked about this a little bit yesterday when we were sort of prepping for this, but could you maybe review that a little bit for people? Like if you have a scope of practice that may include or not prohibit touch, but then there's also this competency around how you use it that you can develop. How does this training sort of play into that?
Right. Well, when we look at the sort of field of ethics, and the training that I do is like highly, highly rooted in ethics because, it's touch and people violate and all the creepy things that happen around that. So that's so funny. I just forgot the question.
It's about the distinction between your scope of practice and your actual competency.
Right. So the scope of practice in psychotherapy means that we have a lot of things available to us. We have any therapeutic modality available to us within our scope of practice, right? We can't prescribe medications, right? But we can offer therapeutic interventions, right? And touch is a valid therapeutic intervention. However, it's not ethical to offer something that you have no training in, right? Or that you're not competent in. Right. And so this is what this training is moving towards is telling people, look, in the world of especially psychedelic assisted therapy, right, that the value of this particular model is that touch has capacity to be supportive and helpful in the therapeutic and the psychotherapeutic psychedelic environment. Right. And so we have a different orientation than maybe, psychoanalytic psychotherapy. Mm-hmm. And so because we have that understanding that this is possible, we want people, especially those who are doing assisted therapy, to be able to be competent in that field, right? Because if you're not competent, that's when you have the potential to cause harm. Right.
And I recall too, this sort of harks back to why we started this whole entire program in the first place, which was that there were not good opportunities for people to get continuing education and training in general to have the competency to even have conversations about psychedelics as part of a therapeutic working relationship. And so we wanted therapists to have a place where they could come and get that training, get that education, be able to document and demonstrate, yes, I did this, I've developed my competency, and here's how. partly should it ever be called into question, but also because it's really a necessary step for people to take who are licensed. And so offering the training in this modality as part of the program is really a fit with that ethos and with that mission, right? It's one thing to say, well, I've experienced this myself in my own therapy, so I've learned something about it there, or I've read about it or something like that. But having that actual continuing education piece is really important in a lot of these spaces. I want to remind folks too that if you have questions while we're talking, please put them in the Q&A, because we're going to get to some of those at the end. So if you've got questions about scope of practice, competency, those sorts of things, we'll try to address as many as we can. But maybe we're sort of starting to turn towards the lens towards how does this fit, and why does it fit in, and why is it important for people who may be working with or considering working with psychedelics? What are the additional considerations there when you start to think about having somebody in your office in a non-ordinary state of consciousness, or talking to somebody about their experiences in a non-ordinary state of consciousness, even if you're not the provider?
Right. So, my orientation is that everybody needs some kind of basic training on psychotherapeutic touch. That's my passion. That's my, because it's always in the room,
Mm-hmm.
right? And so there's a difference between touch and physical contact, right? So physical contact is when skin touches skin, right? But touch can be, you can touch somebody with your eyes. If you move into somebody's physical space, right? So we talk about energetic space, and for Americans, that's usually about arm's width away. And if somebody comes in that is not an intimate into that space, you will feel that energetic invasion, right? And so we understand that touch is a broader concept than physical contact, right? And so that as the general training, all these other things as the general training, the specific considerations around psychedelics is that while consent is always a big component when we're training on psychotherapeutic touch, it becomes amplified when we're talking about working in any non-ordinary state of consciousness, because the person who is in a non-ordinary state cannot consent in that moment. So we have to get the consent on the front hand, right? We have to learn to practice that touch so that we know that they can tolerate it. They can tolerate it in a non-ordinary state. And we need to learn the skills of how do we do that in a psychedelic session so that we're not being invasive, right? So rather than reaching for someone, some of the skills are, you may, if you have consented, if you've had that agreement that hand holding, for example, might be appropriate, that you might offer a hand. You might sense that somebody needs you. You might offer a hand and place it, 5 inches from them, palm up, and gently let them know that my hand is 5 inches from you. If you want it, it's here for you. And the reason why we generally do palm up is so that people don't feel too enclosed and they can remove their hand more easily if they're done with that kind of contact. Right. So there are some really things that are specific to working in non-ordinary states that are different than working in our normal mindset. And some of them are, the same. Like, you always have a right to change your consent, right?
What do you, not to put you on the spot, but I'm curious what you think about this idea that we see, a lot, especially in research settings, but in other settings too, that someone can consent to the use of touch during a psychedelic drug administration or therapy session prior to it. But if they've refused prior, the therapist shouldn't sort of override that during the actual session, right? I wonder if you could kind of speak to that. I know we've taught about it, right? And there are certain regulations and guidelines about that, especially where people are working under more of a regulated framework. What do you think about that? I mean, if somebody has said no and then they've changed their mind, or they say they've changed their mind, and how do you advise people to handle?
In any psychotherapeutic endeavor, we are always weighing beneficence versus malfeasance, right?
Mhm.
Our potential for good and our potential for harm. And so for me, my advice is do not touch unless you have consented to it. But I let my clients, though, know that you may be vulnerable and you may want some kind of touch. And if we have not consented to it, I'm not going to be able to provide it to you. But I can tell you, here are the things that I can provide, right? So if you have not consented to any touch and you're feeling alone, I can sit very close to you, right? If you consent to that. I can provide a weight bag. So if you guys go to my YouTube page, there's a whole thing. My YouTube page that's a whole thing about using weight bags, and basically it's those small like little pillows, rectangular pillows. You fill it about 3/4 full of rice, and then it really has a heavy kind of weight. But because it's 3/4 full, it contours to the body. So if somebody really wants to be held or feel like they need some grounding, you can use a rice bag. Right. You can also put your hand on top of the rice bag, right? So you're not actually touching the client, but that sense of being touched can transmit through, right?
Mhm.
And so you can talk about sort of what are the alternatives if you haven't consented to touch. You can have big teddy bears. You can tuck the client in if they want to be tucked, right? Yeah.
Yeah. Yeah. I definitely am on the same page of advising to have lots of props and pillows and other things that can provide that sense of physical comfort to someone, as well as talking to them about what other things they may find physically comforting, should that be something that they're reaching out for. And some people are really adamant. And I think that, we also want to make sure that therapists know that that's okay, and that we're not messaging to clients, well, you know, something along the lines of, you might not get as much out of it if you don't agree to this, or there's something lacking in you, or going to be lacking in your experience. I don't think that's the case. That's the case at all. And part of the reason why I love, your approach to training in this is because you help people understand the flexibility and the alternatives and other ways of meeting that need, without having someone push past boundaries that may be there for very, very good reasons. Right.
I think explaining to the clients, like, like that I hold our time together sacred, right?
Mhm.
And my job is to really make sure that you feel safe. And so that's why I'm going to be really a stickler on this, right? And there are, other ways that you can do that. So when I talked about the rice bag, like, you can have a sense of contact through an intermediary object, right? So the rice bag is the thing that's between you, so you're not actually touching, but there's a felt sense of connection. Right, we use this a lot in dance therapy where we've got like stretchy material, right? And so we might have our client holding onto the stretchy material, and we might be like pulling back. So we're both kind of pulling back, so you get the sense of energetic connection without actual physical contact.
Mhm.
Mhm.
Right.
And then I also let them know, if we have the first session and you find that you wanted more touch than was available, you can renegotiate your touch contract for the next session. Right?
Right. Right. Great. Great. Yeah, it's really it's really an interesting area to think about. And when I think about it, there's a couple of modalities that we teach that I think it's really important for therapists to get this training in. For instance, especially if you're working with people who are, if you're working with ketamine-assisted psychotherapy, for instance, maybe you work at a center where people are receiving IM or IV, and you're caring for them during those experiences, or you have people who have a prescription and they're coming in, they're sort of self-administering a lozenge or something like that. This training can be especially important for being able to talk through that process ahead of time, and then knowing how to interact with somebody during the session. Certainly relevant for anybody who is thinking about, they're maybe working on a clinical trial, and there may be specifics that are covered within that clinical trial training framework, but it's often limited to what is expected and what the standards for that trial are, and it may not give you as much background as this kind of a workshop and more extensive training will do. There's also the case of folks who are going to be working, under, a state licensure program, such as in Oregon and hopefully upcoming Colorado and maybe some other jurisdictions. Certainly, it's a very important part of the training for that licensure, but it's something that people could do, as a preview to what you might learn there. It's also something you could do just to brush up your skills or to expand your skills or to otherwise enhance your competency. And then I think for therapists who are talking to clients about experiences they may have in other settings, if you're doing preparation work or you're doing integration work, just kind of being able to help your clients to navigate these conversations, to know what their options are, to know how consent should be talked about, can be incredibly informative, and you can really do a lot by just having had this type of orientation and education.
Well, and
So
part of it
yeah.
is, as most clinicians are not comfortable talking about touch. So
Mhm.
even coming into, if you're not doing psychedelically, you're just doing whatever your regular modality is, right? Is having those conversations really early on, like, how are we going to do our hellos and goodbyes, right?
Mhm.
And making sure that we're comfortable. So you're setting the tone early on. It's okay to talk about this stuff. But if we're awkward about it and we're tight about it and we got weirdness, it's going to transmit. So part of our work is to learn how to have these conversations to get comfortable, right? And part of this is not only because of our psychotherapy culture, but the larger, American culture that is generally speaking low touch. I'm not talking about, our little subcultures, like my hippie subculture is all cuddle, right? But the general American culture is pretty low touch.
Mhm. Well, that might be a great place to turn to a question or two from our Q&A. One of which I see here is to ask about any work that you've done with people in other cultures where psychotherapeutic touch or touch in general are utilized more frequently. And are there comments or scenarios or ideas you could share about, how that might change things when touch and touch in general is just more utilized and more frequent?
Well, basically, your consent gets broader, right? However, right, that consent also is about my consent, right? So I come from a high touch culture. I also come from a psychotherapy culture, right? And so if somebody comes from, like, let's say there's me with my friends and then there's me with my clients. So if I'm assisting for a client, it's going to be very different than if I'm assisting for a friend. Maybe not very different, but my friends and I already have a more comfortable touch orientation, right?
Mhm.
So if I'm working with a client that comes from a high touch culture and they want the capacity to be hugged or held, right? I'm probably not going to be comfortable with that in a psychotherapeutic setting, right?
Mhm.
And so there's that component. There's also the component of, even outside of the psychedelic session. So there was a time, so I come from a Mexican culture, even though I'm white presenting. And so I worked a lot with immigrants for, I would say, 3 or 5 years. And so with my Mexican immigrant men who came, particularly those who came from small community, I did not use touch with them because culturally it was just too hard to not orient to touch as sex. Right. And so that was a community that I didn't feel comfortable touching because I felt like it would interrupt the therapeutic container.
Mhm.
And so it really comes down to not only the client's consent, but also your consent.
Mhm. Yeah, and I think that speaks to another question we have in the Q&A as well about cultural the intersection between culture and psychotherapeutic touch, and just having an awareness of how how what your consent is going to be, and how that may be different with different just different populations and different backgrounds.
Right. And the thing is, we just have to talk about it because we also can't make an assumption, right? We can't make an assumption that because you come from a Latinx community, right, that you are going to be high touch. Right. And so it's just like having somebody come in that comes from a different background than you. It's like, I notice, right? I notice that there is a difference between us, and how do you feel about that? Right? What is your asking questions about what is your culture around touch?
Mhm.
And so we just start having the conversations and right and clarify. And the more comfortable we are having these conversations, the less awkward they are. right? And it allows the client to know that this is a topic we can talk about and we don't have to be weird about it.
Right, right. Which and just doing that allows, for that for it to safely be brought up.
Mhm.
And therefore I think it, reduces the potential for harm right off the bat, because if it does happen, it doesn't need to be something people are experiencing in fear or experiencing in secrecy.
Mhm. I always say, like if we know that there's a likelihood that a client is going to be a psychedelic client later on, it's really helpful in the first couple of sessions to just begin having the conversation about what kind of touch do we do in this normal kind of non-ordinary container, because it's like the soft serve in. We begin to have the baby conversation, right, before we then talk about more intimate forms of touch. And some people that they'll also sort of name, even though I name, there's a difference between touch and physical contact, right? There's energetic touch and then there's like physical contact. Some people receive talking about physical contact better than the word touch.
Mm-hmm.
So sometimes using physical contact, what kind of physical contact feels comfortable for you, right?
Right, right. Very important.
Mhm.
We have a question here, and I think it might actually be, there might be more than one person asking, but I see at least one asking about documenting the consent process. And I know that, different, different professions may have different standards of documentation. And if you're working on a research study, certainly you want to follow the standards of what is, how things are supposed to be documented in that setting. There may be forms and things that you need to use. But I'd love it if you could talk a little bit about how you document that conversation. What do you put down? What do you want to write? How much detail do you go into? And is that something that you update on a regular basis? Because I do think that that's important, and we are seeing in regulated settings, Oregon being a good example, that those who are providers are required to document, but that documentation may not be very detailed. So what's your take on that? How would you
I
want
want
that?
to name, to be fair, that this particular training that's coming up will not talk about the documentation process because that's a whole separate several hour conversation. So
Mhm.
this training that we're talking about is ethics and sort of a lot of the preliminary stuff we need. But for the purposes here, in order to document touch, you need to know why you're touching. So what's your clinical validation? So you don't need to name that every single time, right? But you can. So, for example, this was to soothe clients' nervous system, right? To increase therapeutic bond, et cetera, right? Client
Mhm.
ask permission, et cetera. You need to know why you're doing it, why you're touching, what's the clinical validation. You need to document how you're doing it. So when, where, what part of the body, how deep was the pressure, how long was it, right? You need to know when not to do it, right? So they don't necessarily need to document that unless the client asks for touch and you refuse the touch. So for example, if I feel like I've got a client who's doing like a super heavy transference on me and they want a hug and it doesn't feel good in my system, I'm going to decline the touch, right? But I'm going to document that and I'm going to document why I declined the touch. And I'm going to have a conversation with my client about that. Um, and so we need to know what the contraindications are. So one of the contraindications, for example, if the therapist or the clinician is uncomfortable with touch, that's a contraindication, right? Because you need to respect your boundaries as much as you are teaching them boundaries, right? And that gets transmitted, right? Um, and so in the documentation, we document why we're touching, we document where we're touching, we document how we're touching, how long we're touching, and then we document the client's response to it. So let's say that you have a session, you're in a psilocybin session, it's 4 hours into it, they're coming down. Now you're doing a little bit of the integration work, right? They're coming down from now, you're in the fifth hour, they're kind of back. You might check in like, okay, So there was a couple moments when you asked for my hand. How was that for you? Right? What did you notice in that process? And giving them permission to say, and if it wasn't okay, if it was a little wonky, like all of that is okay. So we're trying to avert that sort of people pleasing part, right? And then the next session, you check in again. It's been a week, right? I just want to double check on that. How was that for you? Was it enough? Was it too much? Would you have liked something different? And you document all that. Right? When I document touch interventions, I have a whole, because I probably use more touch than most people do. I am a somatic therapist with a massage background, so my level of competency is larger than most people. I have a whole list of little codes that I use. Right? And as long as you have your own documentation of this is what this means, use your own codes. Yeah.
Right. So knowing for yourself what your rationale is, what your intention is, what you're doing and why you're doing it, is really an important piece of that documentation. You're documenting it just like any other psychotherapy intervention.
Right. And documenting the client's reaction, either the reaction in the moment, right? If they pulled away or something, and checking in with the client verbally. How was that? Right? Would anything have been better? Like, oh, I really needed more pressure, or I wish your hand would have been lower, or I really wanted, but I didn't feel like I could say, especially if somebody's, has ketamine in their system, right? The body doesn't really have a lot of the same capacity, the same felt sense that it does when you're, for example, using psilocybin or something.
Yeah, for sure. And obviously, the psilocybin, many other psychedelics really alter the sense of what it feels like to be in the body. So it may be unpredictable, or it may feel different than they anticipated. And I think that's just another really interesting place to explore, right? Because perception is so far altered in those states.
And there are some special considerations when we're working with MDMA, right? Because MDMA can, for some people, really elicit some eroticism, right? And so really, really sort of naming that in the beginning, that whenever we're doing any psychedelic session, naming here are the potentials of some of the experiences that you may or may not have, right? So clarifying that not only sexual but erotic touch is not part of this process, right? So if I had a client that wanted to hold my hand and then started stroking it, I might actually shift that dynamic. And might give them something like a soft stuffed animal or something else to stroke. Like I don't want them to not be able to experience their own eroticism. I just don't want to be the object.
Right. Right. And I think that's an important place to bring this around to, right? Because when we do that, any kind of consent process or discussion process, we always teach, and I know, you do too, to make it really explicit to clients that any touch used in the psychotherapeutic touch or during as part of our work together, however you want to say it, is non-sexual and is really at your service and intended for, the furtherment of your process. Right. And so sometimes, clients may not assume that, or they may not know that or have that really explicitly clear to them unless we really say it. So I think, an essential part of training is being able to say that, to state that, to be upfront about that, to be clear about that, and to make sure that your clients are acknowledging that and taking that in and understand that, and that it's not a read between the lines kind of thing. That is an ultimate thing. And if we don't actually say it, we leave room open for doubt there. Right. And we can refer back to that later and say, remember that we said, this is, always, touch is always non-sexual in this setting. And so we're going to, make some changes here, and you're welcome to feel the things that you're feeling. And we're also going to maybe make some adjustments in the way that we're handling this.
And I always use the language non-sexual and not erotic. Right? Because those are two different things, right? That something can be non-sexual, but it could be cultivating a kind of touch that I'm not comfortable with. And so the client, if someone is having an MDMA session and they are in their erotic self, great, that's your experience, right? And maybe that's a part of you that's been shadowed and needs to come out, right? And right, there is a way to do that within your own touch component experience that doesn't include me.
Great, great. There's one more question in the chat that I think is really interesting. I'd like to touch on before we wrap up today. And a lot of what we've been talking about is sort of preparation, consent, in session stuff, no matter what kind of session it is that you're having. But we have a question about how psychotherapeutic touch could support the integration journey for clients who may be coming in. Maybe they had their ketamine or their psilocybin session with you, or maybe they had it with someone else in another setting. Are there things that you recommend or ways that you might, use or incorporate touch in the integration setting, in the integration sessions that might have some additional considerations or different considerations?
Absolutely. There is a lot of times, whether it's, a psychedelic integration or, any other session, that sometimes when people are feeling that really isolated, alone feeling, we have a tendency to think about psychotherapeutic touch as being very handsy, right? I'm going to touch your shoulder or we're going to hold hands. But there are other ways that we can use physical contact. So when we're in therapeutic sessions, we're often facing our clients or angled facing our clients. But sometimes when a client is going into a state of aloneness or isolation or feeling overwhelmed, shifting and just sitting next to your client and having the sides of your arms touch really can transmit the felt sense of, oh, I'm not alone. There's someone right with me. Now, of course, this is all stuff that has to be consented to, right? But there are a lot of different ways that we can provide physical contact, right? Or as I mentioned in movement. So I do a lot of, when I do integration, I do a lot of arts and movement and sort of maybe not just the talking parts, right? And so there are things that we can use, what we call intermediary objects, right? So that's the rice bag and putting your hand on the rice bag using stretchy fabric. And I've got this piece of stretchy fabric that's in a circle. And so, if I have a client that is really working on like, I'm never supported, we might both be in the circle together, leaning against the stretchy material, right? And so that sense of like, I can actually lean back and I'm supported, right? So we're touching through an intermediary object. Right?
Yeah. So you've got that connection, and you're also honoring boundaries, you're honoring space. You may not physically be within someone's proximity in the way that may actually be harmful or damaging, but you're also able to offer that interaction. It's beautiful. It reminds me of this thing that we do. Well, we've done it with you at some of our trainings at the end, where we're sort of creating a symbolic connection of our interconnectedness with the web of string. We throw the ball of string through and it's always a lot of fun because people drop it and it rolls all over the place. But that to me, really, part of the reason that I love that exercise is that, you've got a group of people, we've spent some time together, and we're sort of, making a physical manifestation of this interconnectedness that we've brought. And so that it again is another way that you can actually kind of create that connection with folks without maybe creating a risk or going in a place that's not aligned with someone's boundaries. Yeah, it's really nice.
And there's other ways that we can touch. Like I had a client who really wanted touch, but she had so much hesitation around it. So we started out with being across from each other and just having our toes touching. Mm-hmm. And that was what she could tolerate, is some toes touching, right? And then it became the sides of our calves, like what could touch, right? And just giving her the sense of not aloneness. And that's one of the most beautiful things about touch, right? Is that especially in this culture, in this era that we live in, we are horribly isolated. Right? As much as we have all this, this kind of online connection, we we as a culture are really struggling with this isolation. And one of the best things that can help that felt sense of I am not alone is physical contact,
Hmm.
right? Even if it's just a toe.
Something to be said for dipping your toe in.
Mhm.
Um, well, I want to just, I want to bring this to a, wrap up on time. I know folks have other things they need to get to, but I really, really appreciate the conversation with you, Sabrina. It's always fascinating and interesting, and it's a great topic area to dive into. And I really appreciate you bringing such a thoughtful, clear perspective to it, and being so willing to, to share that and to offer that to our students. And I know you've got so much more to offer and so many fantastic exercises and teaching methods and ways of really helping people to engage in this topic that are safe and kind and welcoming and supportive, and really help people to gain and increase that competency. So if anybody's having doubts and you're considering signing up for this workshop, it's in April. It's 2 Fridays. Please do join us. Please give us a try. Give it a try. And if those dates don't work for you, keep tuned to our mailing list or visit Sabrina Santa Clara's website. We've posted the link in the chat for you. We'll put it in the follow-up email as well, because she's got multiple other workshops going on throughout the year that are not necessarily through Fluence, but we fully support any of those that you're interested in going to. We do host them periodically. Probably we're up to about twice a year, but you can get them elsewhere as well. I encourage everyone to continue training, expanding your competency, expanding your curiosity, reading up on these topics, following listservs and newsletters, and Sabrina's newsletter as well, and everything that you can to just help ensure that you've got the most up-to-date training and practice, and connect with colleagues that are interested in this, right? That's one of the beautiful things about this. And we had 75 people online today, all interested in this topic area. So just know that you're not the only one who's curious about it. And when you show up for a workshop, maybe you meet other people who are asking the same questions, and you can create some collegial learning atmosphere together. All right. So we'll just take a minute to say goodbye.
Thanks so much for having me.
Thanks so much for being here, everyone. It's been wonderful to see you, and we hope to see you at another program real soon.
Take care,
Bye.
everybody.
Bye.